My name is Moviru Michael Kaizi. I'm the Quality Assurance Manager in the Allied Health Professionals Council. We came to, this week we are in West Nile. We came to support our staff here to see that the facilities, the health facilities in this area are cooperating within the scope and legally to protect the public, to see that the public is protected, to see that the public gets trusted services. For the facilities we have gone to, because these facilities have been always being reported to us that they don't have the qualified persons, they are not licensed, they are not registered, and their services are not trusted because they don't have the required standard to deliver the services to the public. When we came, since the Monday we came, we've been visiting different facilities, but it's very embarrassing in the laboratories. The people there are not up to the required qualifications to do the lab services, to do the services. When they come to clinics, you see that even some of them are using relatives, others are using non-qualified staff, others were foreign students. This is really embarrassing, and we have taken serious action. We have left most of them closed so that they settle and get the right personnel to work in these facilities. Then to serve that particularly in the lab, because the lab has a lot to measure the health service to be delivered, because we base on the laboratories to make the diagnosis, then we plan the treatment, the right treatment. We've gone to some imaging center in the town there around the roundabout. It's being run by completely nurses, students. Some of them are student nurses, others are somebody student radiographer, which has been very disappointing. It had the 12 patients, moreover from a main hospital. These people are going to make these results, send them to the hospital where they are going to find consultants, and the consultants are going to base on these wrong results to make the diagnosis. Of course, the diagnosis is going to be wrong and the treatment is going to be wrong. This is really very absurd, and we are calling upon other stakeholders and role players to come up and we cut down on this vice so that we protect our public, so that we protect the lives of the people, the innocent Ugandans, who even don't know that this is the right facility or wrong facility. So that's why we are here, to see that we enforce this. We are going to fight up the last person to see that the public is protected in West Nile here. I thank the supervisor in the West Nile. He has been able to bring these people on board because he has every place with the list, and we have involved the police to see that we cause them to do the right thing. And I assure you, by the end of this visit, we shall see that every place, every stone is turned. Shall we leave no stone unturned?
How many facilities have you visited, and how many have you recommended for closure?
But actually, I don't have the toll, but at least many have been recommended for closure because of the below standard that we can see the toll. It's absurd to say that whether medium or low, medium, big or small, the disease is the same. The disease is the same, meaning that enforcement has not been prioritized. We've been too much on the supervision, the inspection and supervision, and thinking that the enforcement may not be required a lot because we thought people would understand what actually we are doing in supervision. But now we have come to realize that now the supervision alone cannot work because the wrong persons are continuing to flood. So we are going to embark on the crackdown itself. Do enforcement, we crack down, we have to arrest them and take them before court.
What does it cost to register a clinic, a drugstore, but also I saw you ask those who work in the clinics, after finishing school, what does it require for them to begin operating?
Apparently, registering a clinic is 200,000 shillings, 250,000 shillings, and even a person, 250,000 shillings. And small money, but people are not paying. It's not that they don't have the money, but they don't have the qualifications. Because you have to be qualified to be given a license to operate a facility. So these people, most of these are not qualified. Because even in the laboratories where we have gone, you see that someone does not have the qualifications to register that lab. But those same persons have been working in these big facilities and they are treating. But also I call upon the public, those who can have the capacity, please have the guts of requesting to see the license for the laboratory. That one will give you assurance that you are getting services from the right facility. You look at the license for the facility, to be sure that you are in the right place. That's the only way that can work. Because we can't be in every facility, but you can be everywhere as a public. So it is our duty and it's a public duty.
What is the penalty for unregistered facilities?
The penalty for unregistered facilities is 3 million shillings or imprisonment of 3 years.
For unqualified personnel?
Unqualified. When we engage you and we take you to court, police then court, you are be sure of getting either a fine of 3 million shillings or imprisonment of 3 years or both.
When I completed in 2023 late, yes, I never had my transcript and those other necessary documents. I never had them with me. So in 2024, which is last year, I had something small at hand. You see, finishing and staying at home is really difficult for us here. It is really very, very difficult. So I personally went to the Allied office there and tried to plead. Much as I've not met the required standards. You see it, if you also find something to keep my skills. How will it be? Could you give me some space such that I keep practicing what I learned? Because as a health profession, you cannot just go to school, you come and sit. It will not be fine. So he wrote for me a letter. And he even personally came here, gave me some form to be filled. I filled it. He told me clearly, just like the way he said, that I needed to meet some standards. He said, fine, I've not qualified to open up my own clinic. I've not reached 4 years experience. He advised me to have a supervisor. Those were his words. I want to put them clear. He said, yes, all these things can be possible. All these things can be possible if given a chance. That was my statement to him. So, I don't know how people can help me based on the situations we have found here. I'm a human being and I'm from a background, if it is supposed to be given to some of you people to be still hard, we have to speak the hard reality. If you are to put yourself into my situation, it will be hard. People are expecting from me, from the family I finished from. They raised me. They tried to educate me, much as I've not attained the level of my interest. It is really hard. We have to understand these things as human beings. This is what I can tell you people. I don't know how it will feel. I don't know Because these things can help also the family I'm coming from. What if I'm the only person who can buy a cup of tea in a day? It is hard. So boss, I'm just trying to explain myself to you. I'm just trying to explain myself to you. So, yes, yes.
Whatever you are saying is very important and it's very good to hear as a human being. But we are not here because we are human beings.
I understand that
We
one.
are here because we are protecting the public using the law. The law sets standards. And those standards are the ones we are telling we should do. Because you are human being, why don't you go to the bank? Because the bank has money. You would be sitting in the bank. But you are not sitting there because you are not permitted by your training. Because you are a human being, you would be in traffic at the road stopping vehicles. But you are not there because you are not permitted. You understand? Because you are a human being, you cannot go to theater to begin operating people. Because you are not a surgeon.
I understand that. I know
You
my
understand?
limits. I know my
Because
limits.
you don't are not your limits. So we are here to tell you the limits that you should have. Everybody has wishes,
Yes.
has problems, has challenges. But if we begin working on challenges and wishes, many people are going to get several problems and several dangers on their lives. So I'm here for the public to be
So,
protected.
boss,
So now I'm telling you, this is not just a wish. This is not a wish, it's the command of the law. Are you hearing?
I'm getting you loud and
So
clear.
you go get somebody to cover the facility and make the facility the standard to be able to give regulated service. You understand? I've just told you, behind there where we are sleeping, it's very easy that you can rape a patient because I've seen them elsewhere.
I know my
And it could even have happened here when that somebody has not come out to make an alarm. Okay? So we need a standard. Let's have a nurse, because you're a man, there should be a lady to protect our female patients in this place. The unit should have a license to regulate what you are doing. We should have somebody
Okay,
in the
like
lab,
now-
not you doing the lab work. You are doing lab work, you do not study it, you are not permitted to
No,
do so.
I normally call some guy here to come.
So
and do
that's
the
what
lab
I'm
test.
telling you.
I only
You
do
first
some
close
rapid
this place,
diagnostic test.
get
So
me right
what
in the
is-
eye. Just first close this place and let it have the standards that are required. And that's what I've said. And the reason why I've come here. So you are giving you this document as a confirmation that we have closed this place. Any more time you continue opening it, we shall enforce the law on you. Thank you.
Thank you so much. By the name's Onega Philip, the Allied Health Regional Supervisor for West Nile region. This particular operation was targeting the facilities that were operating without being registered, and most of them, we had already visited them and they were not responding. So the manager came to give that backup support to talk to them in order to comply and respond to the compliance that requires the operation. Of course, among other things, we look at the qualification of the workers. All the facilities should have qualified health workers, and they should be doing the right thing. Now, over the week, we did 7 laboratories, which have now have agreed to comply. Then today we did 6. The activity cannot be rushed because there are a lot of things that you need to go through. In some places, you get the people not there, and they need to come, the real owners, to explain why, after several visits, why they're not responding. So that is how the activity has been. Thank you.
So those that have been recommended for closed today, like today.
Those who are recommended to be closed today were those facilities that for long did not register. they have not registered. Because for you to be registered, you need to meet minimum standards for operation. So those that we closed were lacking the minimum requirements, and that can only be sorted out when the inspection is done, and then they're told to put the requirements, all those that are required to operate. The 4 facilities we closed lacked the minimum requirements, and we told them unless those things are put in place, that's when they'll continue to operate.
What are these requirements?
There is a complete checklist that is used to check, but the major things are: 1, you should have the premises having all the rooms for the particular for their services. Where are you receiving the patients? Where are you doing clerking from? That is consultation. The lab should be there for the testing. There should be a room for treatment, like the injections. So that's about the room allocations. We also have human resource. They should be qualified. Now, clinics are not like drug shops where you only have one personnel that can handle. We need a clinic officer, a lab person, and a nurse, at least the minimum of 3. Of course, the number increases depending on the number of clients they have and also how big the facility is. There are other things that they also check, that we check: equipments. Are they working? Are they, because we don't limit you from the technology, because if you look at the thermometer, had already gone up to the digital, the infrared during Corona. But what we want are those equipments doing valid tests. So that's also another area that is checked. Apart from the room I told you, the human resource, let's look at the equipments. Issues of infection control. Do you have hand washing facilities? Do you have the bins for waste segregation? All that are looked into. It's actually a complete checklist. That's one. When a person qualifies, then the DHO signs and the person is given a license, now pays for the license.
Okay, lastly, if those who you recommended to get licenses and improve do not, what steps do you take?
Now we have recommended closure. If you continue, you are now taken, you are arrested and forwarded to court. Of course, this will be the backup that you are advised and you are refusing to comply. The major thing is to protect the people, the population. Yes.
How far is the place? Where are the nearest government facilities?
I'm like from home up to this clinic. I can go like for 2,000.
So what is the challenge, especially when a child is sick?
The most challenge here is we don't have any health center which is near with us. Then here even getting transport is a problem. Sometimes even at night you can sleep without any single money. Yeah, it's like that.
So they are saying this place is not qualified. Okay, they don't have qualified persons. How has it been helping you, and if they close it, what will be the challenge?
Now if they close it, we don't know what to do, because even this place used to help us, but I don't know whether it's the direct way or the bad way, we don't know. But it was helping us because the hospital is very far for us.
Like how many kilometers is the hospital?
I tell you that, but for kilometers I did not counted it. But from here up to the Arua hospital is 7,000. If you are 2 people, they can charge you people 4,000. That is 8. You can cost like that.
What's your name?
My name is Brenda Sinju.
So what was the challenge with this child?
For me, I don't know. My child was just was just total. Even at night when you were sleeping, then my child started to cry. After crying, then my child was just unconscious. Even minus not even think about anything. Even if I called him, even though if I called him, cannot even respond.
So has he been helped?
Yeah.
Has the child been helped?
Yeah. Since I came here, my child, now I've seen some small improvement.
Called at the school, I'm from the school. Yes. So I came here, this guy told me, this guy came here to explain. So I tried calling him, the phone was not going. Good enough to call this guy. He should bring a paper to be signed up. So I took the paper there, and then he told me I have to follow immediately in the office. So now I told my problem to him. I told him, since my qualification that I'm having at hand is not eligible for me to operate. The colleague I talked to has actually disappointed me. I would have been done with the issues of license. So he disappointed me. I'm still in the process of getting somewhere. My limitation factor is that.
The question is, why did they open when they were told to close?
Can you close this place now?
I can close it.
And I find it open, I didn't have no option. And I want to see the police officer because tomorrow I want my court case to be very clear. No, we are doing this. Professionals, not running. But if you choose to be, if you choose what you want.